the stress that is kind of increasing in our society, right, is also linked to all these food intolerances, allergies, and gut problems, also sex hormone problems, thyroid problems, right? Because I feel like everybody has it meanwhile, kind of. And especially, food intolerances, gut issues. Dr. Lars Nill worked many years in conventional medicine, hospitals, and practices. The search for the root causes of diseases led him then to the following qualifications. You're qualified in functional medicine and stress medicine in the US and in Germany, in acupuncture and laser medicine, and you're a certified expert in gut health with 10 years of clinical experience in alternative medicine, and you own a private practice here in Berlin. And so you're definitely an expert to this discussion and to this topic, because, I remember reading The Myth of Normal from Gabor Mate and reaching out to you, and you were saying that you just finished, or you were reading The Body Says No. And in his book, The Myth of Normal, Gabor Mate takes pains to illuminate the link between psychological and emotional trauma and physical sickness. For example, he says that women with cancer are often found to suffer from emotional suppression, avoidance of conflict, rationalization of their emotions, or even grieving parents had double the risk of multiple sclerosis. And objective stress on kids is linked to obesity, insulin secretion, and the function of their immune system. So, Lars, I know this is a very, very complex question that we could talk about for hours, but can you briefly explain to us how trauma actually impacts our physical health?
Sure. First of all, thank you for having me. It's a pleasure to talk about this topic. I would like to share some slides on this topic. First, a small medical disclaimer. The information is just for informational purposes. So, to summarize what happens if we have suppressed emotions. So this emotional stress is acting on our brain, actually on our HPA axis, our so-called stress axis. So the hypothalamus is communicating with your so-called adrenal glands, which then produce cortisol, our stress hormone. And that alters all our body systems. So this HPA axis, it's a survival mechanism, and it was just, let's say, designed by whoever to be acted upon or to be activated in short term, not in long term. So if you step on those on this system, on this gas, let's say, then everything that you don't need on a battlefield gets sacrificed, and that's a lot. So on a battlefield, you need your muscles to swing a sword, you need your heart and your lungs, and you need a small part of your brain, the so-called reptilian brain, which has to do a lot with fear and panic attacks and reflexes and whatever. And everything that I just didn't mention gets sacrificed just in order to survive. And that's a big issue. So first of all, this system number one falls apart. And not only cortisol, the stress hormone in our adrenal glands, gets produced, but the other so-called catecholamines, kind of stress hormones as well, adrenaline, noradrenaline, dopamine first get cranked up, and then over the course of time, as cortisol decreases, all these neurotransmitters decrease as well. And it's a big issue with serotonin, for example, as well. And sexual hormones, we don't need to reproduce on a battlefield, so they get sacrificed as well, which can lead nowadays to, for example, having issues becoming pregnant. And then your thyroid hormones are decreased as well, And so you can suffer from like overweight or having problems losing weight, or you're fatigued. And so this stress axis is actually the main issue that you just mentioned. For example, with stress, with trauma, we can get cancer, for example, or autoimmune diseases. So the main system that gets hindered in its function is the immune system. If this immune system is dysregulated, um, it can cause autoimmune diseases or allergies. And if it's not working properly anymore, if it's too weak, then we can get cancer or infections.
Right.
And the immune system sits to 80% in the gut because it's the biggest, let's say, surface to the surrounding world. So it needs to be protected. So with this stress, the immune system is hindered. And so in the gut, we get pathogens. I call them bad guys. We can develop food intolerances and a so-called leaky gut. That's a kind of fancy term for your gut, shown here on the right, gets too permeable to things that shouldn't enter the body, shouldn't enter the bloodstream. So toxins, um, uh, parasites or bacteria or even viruses, and undigested food. And so the immune system overreacts because of this.
Right. So it somehow makes sense that the stress that is kind of increasing in our society, right, is also linked to all these food intolerances, allergies, and gut problems, also sex hormone problems, thyroid problems, right? Because I feel like everybody has it meanwhile, kind of. And especially, food intolerances, gut issues. So this makes so much sense that the more we are under stress, right? Even if it's like external existential stress, like war going on, or even being a parent all of a sudden, right? Sleep deprivation, surviving parenthood is kind of a stress on the body and the system, right? So, yeah. And so, can you help me to understand then what are the common diseases that show up due to emotional suppression? Because, what I see quite often when people say they have chronic headache or chronic digestion issues, or, I have just a client who says that both of his parents are cancer, and he feels that this is because they've been never showing emotions, right? And so what are the common diseases as a result of avoiding feeling or suppressing emotions?
So actually, I have to talk about one system as well. So there are many body systems, but if the immune system in the gut gets a problem and it's the gut lining gets hyperpermeable, then toxins overwhelm your liver, and then you develop something called, sorry, that slide is missing here. You develop silent intoxication and silent inflammation. And why am I showing this after your question? Because from this silent intoxication and silent inflammation, every disease, almost every disease known on this planet can be caused. So to answer your question, it's not that easy, or it is kind of easy, because there are no specific diseases that are caused by trauma. Everything can be related to this.
Right. Okay. So this is a good link to my next question. How do you notice that certain physical diseases are linked to past traumatic or stressful experiences?
So in functional medicine, we have a very long, let's say, anamnesis or first appointment. It's not usually from 1 to 2 hours. So I sit down with my patients in the first appointment for 2 hours. And so we talk about the whole life, even pre-birth. So how was the health of your parents? How was pregnancy while you were in the womb? How was the onset in life? And so we talk about the whole lifespan, and that's where I can spot things like, oh, early on there's something happened in your family,
Yeah.
and so on. And as well, I observe, of course, the patient, his posture, and
Mhm.
is he overtight, how he's reacting to things. Sometimes people get a rush in their face when asked certain topics or certain questions. So
Right.
yeah, it's a combination of asking like a lot of questions about their life and
Mhm.
then observing how the people react.
And this is exactly what's been really missing so much when you go to a regular doctor, right? That so many doctors never even ask the questions, even like, experts on autoimmune diseases. Have you actually ever suffered from a traumatic experience in your life? So, what they do a lot is working with the symptoms and giving medication that helps with the symptoms, but not diving in, as you just explained so beautifully, into even how was your experience in your mother's womb, right? So you saying that even that experience has already an impact on our stress hormones, on our immune system, right?
Yeah, definitely. Yeah. It's not just about genetics, it's
Mm-hmm.
about epigenetics. So what's acting on your genes, That's
Yeah,
your psyche from the inside, and that's from the outside world, toxins, lifestyle, how you eat, and so on.
absolutely,
Yeah.
absolutely. No, I just have some clients in my mind who were, for example, adopted, right, as babies. And that's quite a stress on a baby's emotional experience, right? It's a kind of like abandonment, you're not wanted. And so you would say that if somebody would say I'm adopted, or my parents split up during the pregnancy, or there was a traumatic experience during the pregnancy, that you take that into consideration for the treatment, right?
Of course. Yeah, we have to.
Yeah. And so how do you actually work with these patients?
So it depends, if the patient had a trauma, but I see maybe it's not the biggest issue right away to work on, then I focus first on his physical health, and
Mhm.
I do diagnostic tests with him, and then treat lab-based and treat with lifestyle recommendations. And if early on I see, wow, okay, that's the biggest trigger is his psychological trauma, then either first he needs to seek like psychological help, or parallelly to my work with him or with her, with the patient, um, I send him to psychologists. So
Right.
it depends, if he. So my statement is kind of. Sorry, I just scroll through. My statement is, working in functional medicine, this physical health is our platform for emotional and spiritual growth. But as I said, if the patient suffers too much, like although it was in the past, he suffers now chronically, acutely in front of me, then I cannot wait until his body is fixed, and we have to work simultaneously on his psyche as well.
Right, right.
But
Okay.
if I have
Mhm.
time, that's usually the case. And then first of all, we address lifestyle coaching or lifestyle issues, so diet, exercise, sleep, and stress management. And then we test those systems. We test neuroendocrine system. We look for his circadian cortisol rhythm, or his so-called stress axis. We look into the gut, do a PCR stool test, and look for infections and inflammation, and if the gut is hyperpermeable. And then we look into the detox system, how if he's full of toxins and cannot excrete them like efficiently or fast enough. And if I have all these lab results, then I can treat in this sequence how the disease developed. And so if I find something in the stress axis because of his trauma, then I would first address the stress axis, and then later on, if the immune system is then stronger, then treat the infections and close the holes, let's say, in this leaky gut, and then at last help him with detoxification.
Okay. So, but what I understand what you're trying to say is that when you see there is a lack of improvement, for example, right? Or you see, you know, certain patterns continuing within the client, then a holistic approach is necessary, right? So, for example, if the client continues suppressing anger and continues, you know, not listening to her own limits or his own limits, not setting boundary in his life and getting, you know, burned out at work, then it's hard to just work with these steps.
Yeah. So yeah, it depends what the patient brings into the room, what I see, what I hear.
Yeah.
Yeah.
And so as somebody who also works, you know, with acupuncture and laser medicine and, you know, in general, you know, TCM, traditional Chinese medicine, how do you bring those into supporting someone actually releasing some suppressed stress or feelings?
You mean besides functional medicine, if
Yeah.
I work with TCM acupuncture? So
Yeah.
yeah, that's where acupuncture shines, you know. Acupuncture helps a lot with pain and helps a lot, so not just psychological pain, but physiological pain, or but it helps the patient to relax a lot. So it helps to release the tension in your fascia. I would say in your so-called subconscious mind, you know, the body stores this energy, stores this trauma. And so in, let's say, Chinese medicine terms or ideas, pain, or like, let's say, emotions, that's just energy not being able to flow correctly anymore.
Yes.
And so sometimes people say emotions like energy in motion or energy not in motion.
Yes.
So we help this energy, this chi, to flow again. So I love to combine like functional medicine, like lifestyle medicine and supplements, to combine this with ancient knowledge. So with acupuncture, with the energy flow, with the energy system. Yeah.
Yeah. Yeah. Okay. So what's the most important advice you can give someone with chronic pain or autoimmune diseases?
I would say, first of all, don't give up.
You don't need the presentation. Maybe we can close it.
Yeah. So I would say, first of all, don't give up. There's hope. Don't rely on just conventional treatment. Sometimes I'm a conventional trained doctor as well. Sometimes it's needed. And so don't give up. Do your own research. I think functional medicine shines with autoimmune diseases because that's where this, let's say, conventional medicine paradigm, this idea that you treat just the symptoms, it helps in a short term, but long term, you have to work on the causes, and you have to be taught how to help yourself, how to change your life, how to treat your psychological traumas. And yeah, so I would say, yeah, don't give up.
And I think that's the most important part, right? Because so many of my clients ask me, for example, is it possible to heal, right? Maybe after a few sessions, not noticing the change they would like to have, right? They get a bit hopeless and feeling like, well, I've been like that my whole life. How can I now feel my emotions while I've been suppressing it my whole life? And I also say, like, you know, it's a long process, right? And it needs a lot of, Yeah, it needs a lot of stamina and a lot of determination, but it's possible. And so it's the same for you. You're saying, don't give up. I mean, I experienced something with you, something, right? I had gut issues for many, many years, and you really helped me. And now I really know now how to help myself, what causes what kind of issues. And I've been really symptom free for more than 8, 9 years now. And so it was hard because it cost a lot of life changing
It's
decisions.
an effort, yeah.
It's an effort, right? And so, but it's possible to kind of help yourself. You don't have to live with this.
And you need energy for this. You need the chi, or let's say in biochemical terms, you need ATP from your mitochondria. And if you have trauma, if you have chronic stress, then all this energy from, let's say, cortisol decreased. Cortisol is not just a stress hormone, it's an energy hormone. So if you have chronic stress, then you have lack of energy because you have a lack of or decreased cortisol, and you have damaged mitochondria. And so if you don't have energy, you don't feel the capacity to change something. So you don't see the possibility anymore. And the more people or my patients get their energy back, the more they get hope back into their beings. And then things can start to change, right? And then they have the capacity to work on their psyche as well. Yeah.
As you said, emotion means also energy in motion. So actually also allowing ourselves to feel make us more energized, right? Even if it's a difficult feeling, but it gives us the energy and the motivation for taking the steps that are needed. Okay, yeah. So what's the most common disease you see, for example, in Germany?
A lot gut issues,
Yeah.
of course, because it's our second brain, it's our emotional brain, and so there's a gut-brain axis, but there's a brain-gut axis as well, and so the gut function suffers, and so I see a lot of IBS, IBD, so irritable bowel syndrome, or worst case in the gut, irritable bowel disease, inflammatory bowel disease, so Crohn's disease and colitis. So I see a lot of gut diseases. I have a lot of patients with CFS, so chronic fatigue syndrome, especially after corona infections or even after vaccination. And yeah, hormonal issues a lot, not just because of, psychological stress or trauma, but because of toxins as well. So environmental toxins, there are too much out there right now, and as our body cannot cope with this anymore. And so those toxins act like hormones in our body or block our hormonal functions. So that's a big issue as well.
Absolutely. Yes, yes. Well, Lars, this is such a important topic because I think we all know what it's like to struggling with one of the issues you just mentioned, right? And we all know what it's like to feel under stress. And when we're under stress, we just don't feel good, right? We notice that something is not flowing, something is not, the energy is not flowing. It's not in line with how we would like to feel about ourselves. And so if you could say once something that could be motivational for someone, for example, reaching to someone in your profession and reaching out to a functional medicine doctor, what would be your suggestion?
So, yeah, as I said, don't give up with functional medicine. There's a solution, but it's not the only solution, functional medicine. Functional medicine, actually, if you look at those systems that I just showed you, it's actually, you will find the same in Chinese medicine, or you will find the same paradigms in Ayurvedic medicine. So it's actually, functional medicine is just trying to bring the traditions, 1,000 years old traditions, into our modern world and combine it with supplementation and combine it with new diagnostic approaches. But I would say this is timeless knowledge. And I study Chinese medicine as well. And they say the biggest trigger to chronic diseases, or biggest cause, is suppressed emotions, energy not flowing. So I would say it's timeless, not just theories, but timeless practical medicinal work. And so it will always be the answer to get a guide first, and that helps you to act on your problems. And then hopefully you don't need them anymore. Hopefully my patients in 6 to 12 months, sometimes they don't need me anymore, and they learn how to care for themselves. And that's, the biggest message is you have to learn how your body functions, how your psyche functions, and you have to be taught how you can treat yourself and heal yourself.
Yeah, and I like to finish it by what you just said about what Chinese medicine says, right? That so many diseases are the consequence of emotional suppression. So, okay, thank you, Lars, for this inspiring, informative interview. I hope you enjoyed listening and watching this beautiful interview with Dr. Lars Nill and his presentation on how trauma and stress impact our bodies. If you would like to have further information on trauma, emotional suppression, stay tuned and subscribe to my YouTube channel.